Are you saying we should do a status quo? Kasi what we're hearing from Ami from the Philippine Star is maaring we stay with GCQ pero may ilan pang pagluluwag na gagawin with some industries, which I suppose is a modified kind of GCQ din. Yun lang, hindi siya kasing luwag ng MGCQ.
Do one of my colleagues want to answer?
Yeah. I think Ami heard right. I had a short meeting with some members of the NTF, conversations with them the day before yesterday and yesterday, and I think the consensus, not only with some of the members of the cabinet and also the mayors of NCR, the big question here is NCR. Okay, in other places, I think their conditions are much better, and they can easily move to a less restrictive status. But for NCR, which is the big question where the epicenter of this pandemic continues to be, it's clear from our mayors, from some of our government officials, that I think it's fair it's right actually to sustain a GCQ status until we improve our health indicators here. And they are improving, by the way.
Yes. Mukha namang nakikinig sa inyo yung mga policy makers natin eh. Kaya lang, of course, we can expect the economic cluster to push for the revival of the economy. May mga binabanggit silang mga sectors in particular na kailangan dagdagan na yung buksan sa retail, tourism, travel, film, the performing arts. Saka medyo pagluluwag pa ng konti sa transport, pinupush nila. Are there any particular sectors of concern for you? Kahit mag-GCQ, mukhang mag-GCQ pa rin na matagal, pero mukhang gusto nilang dagdagan yung mga activities na papayagan na. Are there any sectors na you are concerned kung papayagan na nga, starting October 1?
So let me answer that.
I think the tourism and transport sector are key. Okay, yeah.
Yes.
So if you actually look at the data for September, there is a very interesting spike in cases on the 17th and 18th of September. So if you look at that, it's actually about 300 more for those 2 or 3 days in a row, which is very surprising until you look at the mobility curve for the NCR and you realize, if you remember, around the 12th, the Department of Transportation announced a loosening of the shortening of the social distancing. And so for 3 days, we had shorter social distancing. And you can actually see a spike of several hundred cases in those 3 days. So this is why we have to be very careful. We only it was an experiment. We relaxed for 3 or 4 days. And you can actually see a very small spike of several hundred cases about 4 or 5 days after that, which is what you would expect if the increase in mobility will lead to infection. So this is a little experiment we tried in September, and you can see what happened. And the concern is that anything that increases mobility drastically will.
Father, if you don't mind, I want to put a fine point on that. No, this was the time, as you said, where there was some confusion as to whether or not we are going to change the minimum standards for social distancing in public transport. This, in other words, actually at that time, to qualify it, it wasn't really clear if this was new standards, but clearly this was the communication, and it caused a lot of confusion. What I wanted to point out was it's not necessarily policy. It's not necessarily. It was pure communication. It was the impact purely of communication. Is that a fair statement?
So I think
implemented for 3 days.
Implemented for 3 or 4 days.
Okay.
You can actually, in the Apple mobility data, if you look at the Apple mobility data for the NCR, you see a spike in mobility for 3 or 4 days. So you actually know it happened. So it happened. There were more people. It was about a 10% increase in mobility. And that 10% increase in mobility resulted 5 days later to 300 or 400 more cases than expected.
Wow.
So, again, we have a little
Incredible.
experiment already. So if what will happen in the answer, we have to be very careful. We have to be very gradual. I think it's important. I agree that the economy has to be there. But if you look at elsewhere in the world, one of the things we have learned is we have to be very gradual. You change something, you wait 2 weeks, you watch something happen, then you change a little bit more. So you change it gradually, and then we wait to see the impact. I think that the danger is if we change too much too quickly, we will not be able to see the effects until it's too late.
Okay, very basic question, Father. Very basic question lang. Sorry, Lucy, mabilis lang. Gusto ko lang maintindihan, for our own education, next time we notice things like this, the 4 or 5 day gap, as you said, is that a good guidepost? If we notice anything in the numbers, that's a good exercise for us to think what happened 4 or 5 days prior.
So usually it takes 5 days for 50% of the population to show symptoms. So what will happen is that's when you expect they will go to get tested, right? So what I noticed is I noticed the spike first. I said, why is there a spike? And then I went to the mobility, and then I noticed there is a spike in mobility. Then I Googled what happened on that day, and then you can see what happened on the day. So you have to look for patterns in the case. And so anyone can look at it. The data is there. The data is there that we changed it for 3 or 4 days, and we saw a spike in the number of cases.
Okay, so
Down because we shut it down after 3 or 4 days.